Good evening. I'm David Niles, Chairman of the Deming Center Advisory Board. On behalf of the board, Dean McGlaris, and Columbia Business School, welcome to the 2020 Deming Cup virtual celebration. This year, more than ever, your support of the center and your interest in improving quality and operational excellence matters. Thank you, thank you, thank you. We've all been tested the past 7 months. However, if there is a single bright spot, an inspiration to all of us, it is the amazing example that our healthcare leaders and hospital frontline workers have set about rigor, hard work, and selfless stewardship. In just 7 months, these leaders have created a new standard of excellence, inventing new models of care, dealing with unimaginable challenges, adapting their organizations on the fly, all while literally saving lives. In normal times, the Deming Cup is open to nominees across all industries. But this year, the Deming Cup Judging Committee elected to award the Deming Cup within one industry, healthcare. It is our way of recognizing the critical role the industry and its leaders have played during the COVID-19 crisis. No other part of society deserves it more. Tonight, we recognize the accomplishments of 3 leaders of some of the most extraordinary institutions in healthcare: Michael Dowling of Northwell Health, Kevin Sowers of Johns Hopkins, and Craig Thompson of Memorial Sloan Kettering. We also want to take the time to salute and acknowledge healthcare leaders across the country and indeed across the world for their spirit of duty, courage, and perseverance in the most extraordinary circumstances. Before diving into the ceremony itself, we did want to share a few thoughts on what you're contributing to tonight by your support of the Deming Center. The Deming Center works to ensure that operation skills, quality expertise, leadership excellence, as defined and taught by W. Edwards Deming, stays relevant and actively taught to the next generation of business leaders. When you look at the founding kernel of many of the more successful and disruptive companies, you will see Deming's ideas of the importance of data, of thinking disruptively, of treating employees and communities well. These principles are timeless, and they are crucially relevant in the moment we find ourselves in today. At the Deming Center, our work falls into 3 broad categories. 1, we support cutting-edge research. Over the past 10 years, over 70 PhD-level applied research studies have been funded by the Deming Center to advance our understanding on crucial elements as how advanced analytics is transforming supply chain, or how digital customer relationships are reshaping merchandising, pricing, and even manufacturing across different product types. 2, we support innovation and best practice sharing among our sponsoring companies. Each year, we host hundreds of executives for forums on topics such as operational excellence in the digital age and the transformation of the retail economy. We've organized study tours to visit market leaders such as S.C. Johnson, Amazon, Ocado, GE, and FreshDirect. 3, and most important in my mind, we support students by teaching Deming principles to the MBA community. The Deming Center has added to the core curriculum by creating new classes in advanced analytics and publishing case studies for use at Columbia and beyond. We have brought leaders from firms such as the Cleveland Clinic, GE, IBM, Marriott, McKinsey, and the rideshare Via to visit the school through our Practitioners in Class series. Sharing this outside-in perspective from real leaders to Columbia students is the hallmark of what the Deming Center does, and is a remarkable way for us to reinforce the broader commitment of Columbia Business School as the center of business. And now I'm privileged to officially begin tonight's ceremony by introducing Terry Lundgren, co-chair of our judging committee, past winner of the Deming Cup, and overall super friend of the centers. Terry, thanks for being with us tonight.
On behalf of the entire judging committee, it is my pleasure to welcome you to our first virtual Deming Cup Award ceremony. It has been my honor to be part of the Deming Cup since 2012 and help promote the principles of continuous improvement and operational excellence in companies throughout all industries. And in a time of upheaval and reinvention, I think you would all agree that Deming's principles are more relevant today than ever before. The Deming Cup lost a dear member of our Deming Cup family this past April, a former Secretary of the Treasury, Paul O'Neill, who was a founding co-chair of the Deming Cup. Paul was a staunch believer in the values of ethical, people-focused leadership, and he was the inaugural winner of our Lifetime Achievement Award in Leadership in 2016. In his later years, Paul championed quality and operational excellence in healthcare and had a true passion and generous spirit regarding that subject. So we all believe that we are honored to dedicate the 2020 Deming Cup Award ceremony to Paul's memory and to his amazing legacy. So as we now move forward into our first award presentation of the evening, I'm delighted to welcome Brent James, a physician and healthcare professional extraordinaire who is currently clinical professor at the Stanford University School of Medicine. Brent has dedicated his professional practice to furthering quality and operational excellence in his field. He is a winner of the 2011 Deming Cup, along with the late Sergio Marcioni, and a member of our judging committee, and quite frankly, he's just been a great friend of the Deming Center. So please welcome Brent, who will introduce our first 2020 Deming Cup honoree.
He was the oldest of 5 children in a poor Irish family. At 15, his father suffered a permanent disability. He took a job at a local factory to help keep food on his family's table. He was an Irish national champion hurler. Hurling is a sport of ancient Irish warriors designed to keep them fit for battle. It involves hardwood clubs and a small hard ball. It's fast, it's furious, and it's nearly always bloody. It makes sports like rugby look relatively genteel. He was the first member of his family to attend college, graduating from University College Cork. He then scraped together enough money for a one-way ticket to the United States, where he worked his way through an advanced degree in social policy at Fordham University. He became a professor and then an assistant dean at Fordham. He then moved to healthcare oversight with the New York state government. That led to leadership positions at Empire Blue Cross Blue Shield and, eventually, North Shore University Hospital on Long Island. Across the next 18 years, he grew that hospital into Northwell Health, the largest health system in New York, with more than 74,000 employees, 23 hospitals, 800 plus outpatient settings, a medical school, a nursing school, a truly impressive clinical research effort, and more than $13 billion in annual revenues. Northwell now delivers more than 30% of all care in the New York market. Oh, then the real challenge hit. Northwell found itself at ground zero in the largest outbreak of COVID-19 in the United States, where many organizations would have fallen. The Northwell team, not just the executive group, but more importantly, their front line, came together, doubled down, and pushed forward. Northwell emerged from that fiery furnace stronger and better, as measured in the lives of the people it serves. It's a classic profile in leadership. Northwell's CEO has put together an exemplary leadership team. Across Northwell, he's not just respected, but truly beloved. Every Monday morning, he still personally greets and orients every new hire. Oh, he did it all based on Deming's quality principles. He now adds the premier national recognition for quality, the Deming Cup, to the many awards and recognitions that he's heretofore received. He's the 3rd healthcare professional in the nation to be so honored, and the first social worker to receive a Deming Cup award. I predict that Northwell, under his leadership, will reach even greater heights of quality and excellence in the future. I give you the first winner of the 2020 Deming Cup, Michael J. Dowling.
Thank you, Brent, for those kind words. And I also want to say thank you for your extraordinary leadership over all these years in the area of quality and performance improvement. It is with extraordinary gratitude and humility that I accept this very, very, very special award. And I want to say a special thanks to the Columbia School of Business for their unbelievable contributions over all of these years since their founding in 1916. And I also want to take a moment to say special congratulations to my fellow awardees, Kevin and Craig. Congratulations to you both. Now, the year 2020 has been a unique year. different than most that we've all experienced. It is going to be etched in our memories for a long time. New York was at the epicenter of COVID at the beginning back in March and April. And we here at Northwell were the epicenter of the epicenter. We saw over 85,000 COVID patients. It tested us. It challenged our character. But we were successful. We saved lives. We improved people's conditions. All done because of the unbelievable, hard, heroic, courageous, and compassionate work by our employees. Healthcare workers, as has been demonstrated, are special people who do special work. And we in healthcare have a special obligation and a special responsibility. Any success we had in dealing with COVID is due to our long-term commitment and investment in creating a culture of continuous improvement and a culture of continuous learning, putting the right people in the right places, putting the right processes in place, developing the right structures, having a unity of purpose, and a constant focus on innovation and creativity. We will undoubtedly have other tough times ahead. Bad things happen. But whatever happens in the future, we are going to be ready. That's what healthcare does. As Deming said, we are always changing and we are always learning. Thank you again. Thank you so much.
Good evening. It's a great honor for me to be with you this evening, but unfortunately we cannot be gathered together as we normally would be to recognize the winners of the Deming Award. But 2020 is a unique year, as we all understand, and we've all had to adjust and respond accordingly. But it still is a privilege for me to be able to recognize some of our leaders with the great work they've done within the healthcare system across our country. But it's especially a privilege for me to recognize the gentleman from my old alma mater, the institution where I was a trustee for many, many years. That's Johns Hopkins. And Kevin Sowers, the president of the Hopkins Health System, done a phenomenal job. It's really also a privilege for me to introduce to you Ron Daniels, who's the president of the University of Johns Hopkins. Ron really brought the entire enterprise together to come up with a unique approach to address the challenges that everyone faces within healthcare and dealing with the pandemic. I mean, Hopkins speaks for itself. You see the notoriety, it's referenced constantly. It's even been mentioned in the vice presidential debates. But the institution and enterprise did a phenomenal job in responding. And Kevin led those efforts and was very unique in what he was able to contribute. But again, let me introduce to you the president of Johns Hopkins, Ron Daniels.
Good evening. My name is Ron Daniels, and I'm president of Johns Hopkins University. Tonight, I have the great pleasure to recognize my colleague and friend, the 2020 Deming Cup Award winner, president of the Johns Hopkins Health System, and executive vice president of Johns Hopkins Medicine, Kevin Sowers. I can think of few more deserving of this honor than Kevin, who has never ceased to push himself and the institutions he has led to do ever more extraordinary things in the pursuit of better serving people. It's that need always to do more and do better that quickly earned him the moniker King of the Stretch Assignment. It began when one of his mentors at Duke asked Kevin that he develop an inpatient oncology unit from scratch. At first, he politely declined, but she insisted that Kevin could do it. And of course, he did. He has subsequently carried forward this spirit in all that he has done, always seeing in others what they couldn't see in themselves, and urging them to take opportunities for which they may feel not entirely prepared, but at which Kevin knew they would excel. Of course, however, it's not only people who need to take on stretch assignments, but institutions as well. And there is perhaps no greater stretch assignment than leading an institution through a once-in-a-century global pandemic. Yet again, Kevin has performed this feat with unflappable grace, humanity, and skill, and thanks to his signature bow tie, sartorial excellence. From the minute we learned of the threat posed by COVID-19, Kevin, just as he did when he was a young nurse on the front lines of the HIV/AIDS crisis, leaped into action, always staying several steps ahead of the disease. He was instrumental in helping our 6-hospital system, which spans 2 states and the District of Columbia, seamlessly transition in caring for COVID patients against an uncertain and ever-changing scientific and logistical landscape, and in thinking strategically about resource allocation, supply chains, and how to expand our reach through partnerships. The end result of all this work is the same as it has always been for Kevin. More lives have been saved. More lives have been improved. Kevin, for leading your institution through the stretch assignment of a lifetime, you are the true embodiment of the principles that undergird this wonderful and well-deserved recognition. It is my great pleasure to present this evening my friend, a great leader, and the 2020 recipient of the Deming Cup, Kevin Sowers.
Thank you, Ron. I want to start by saying how very honored I am to join the Deming Cup family, and I appreciate the efforts of the event organizers and the selection committee in bringing this moment to fruition, even in the midst of a global health pandemic. I am also honored to share this year's award with 2 fellow academic healthcare leaders, Craig Thompson and Michael Dowling, particularly during a year when I think the world is seeing the ability of our tripartite missions of patient care, research, and education to help address some of the major challenges facing our global society. I want to begin by thanking my mom. If it wasn't for her, I wouldn't be standing before you today. It is true that she gave birth to me, but what's even more important is she also supported me in becoming a nurse in a time when it was not common for men to join the nursing workforce. Secondly, I'd like to thank my fiance, Anthony Evans, who without his ongoing love and support, I would not have been able to be successful in managing the complexities of work and life. I also want to thank the essential staff around the world that continue on a daily basis to care for our communities in the midst of this unprecedented time in our society. As you might imagine, I'm especially proud of the entire Johns Hopkins Medicine team. And when I talk to our teams, I often talk about how we're all connected. We are committed to delivering on the promise of medicine together. And the way we do this is by working together to drive a dynamic culture of continuous improvement and operational excellence that we mindfully hand off from one generation to the next. We must also remember to be open and transparent about what we're doing well and where we have challenges, so that together we can collectively be better each and every day. By creating this dynamic but structured framework, when something as momentous as a pandemic occurs, we are able to respond quickly and in a unified way. I can't say that when I began my career as a nurse at the bedside, that I ever imagined becoming the president of Johns Hopkins Health System or being counted amongst the extraordinary individuals who share this prestigious Deming Cup Award legacy. But for this, I am honored and I am humbled. And I sincerely thank each and every one of you.
Good evening. On behalf of the Deming Center at Columbia Business School, thank you once again for joining us. Today, along with recognizing the exemplary leadership of our awardees, we would also like to express our heartfelt gratitude to each and every healthcare worker in the world. Thank you for your selfless and tireless dedication towards providing care and saving lives through the COVID-19 pandemic. We are incredibly grateful for your tremendous service to humanity. And now it is my pleasure to welcome our next presenter, Marie-Josée Kravis, who will be introducing our final awardee for the evening. Marie-Josée is a renowned economist specializing in public policy analysis and strategic planning. She is a published author and a prolific columnist and contributor to various Canadian and US newspapers such as La Presse, The Gazette, and The Wall Street Journal. She's a member of the International Advisory Committee of the Federal Reserve Bank of New York, a senior fellow of the Hudson Institute, and president emerita of the Museum of Modern Art in New York City, where she served as president for 14 years. She was instrumental in the establishment of the Marie-José and Henry R. Kravis Center for Molecular Oncology at Memorial Sloan Kettering. The center is a unique and intensive effort to transform cancer care through the genomic analysis of patient-derived tumors. She is chair of the Sloan Kettering Institute and vice chair of Memorial Sloan Kettering Cancer Center. Ladies and gentlemen, please welcome Marie-José Kravis.
I'm delighted to introduce physician-scientist Dr. Craig Thompson, the Chief Executive Officer of the Memorial Sloan Kettering Cancer Center, the world's oldest and largest, and I'd say one of the best private cancer centers. Now, if I had to find one word to describe Craig Thompson, the word that comes to mind is polymath. Craig is a physician who is deeply devoted to patient care. He oversees over 20,000 employees, more than 500 beds, more than 840,000 outpatient visits per year. He oversees an education program that involves roughly 13,000 people, nurses, fellows, postdocs, and students enrolled in continuing education. He oversees one of the world's leading cancer research programs, ranging from basic science to translational medicine to roughly 1,000 clinical trials per year. But the word polymath extends beyond MSK. Craig is an avid reader, insatiable curiosity. He is a keen sportsman. I'm told he's a wonderful cook, and that in fact his salmon recipe is hard to beat. And of course, I was terribly impressed by his knowledge of rock music when I brought Roger Daltrey of The Who to MSK to help with the fundraising event. But I decided to ask people who work with Craig, either in the hospital or in management or in his lab, to tell me about him. And here are some of the responses that I received. The most impactful mentor I've ever had. The most well-rounded genius I've ever met. But one expression that recurred time and time again was the expression, glass half full. And that's what a leader really is. Someone who can inspire, someone who's ambitious, an innovator, determined, and someone who administers hope with rigor. I can't think of anyone more deserving of the Deming Award.
Thank you, Marie-José, for that kind introduction. I would first like to thank my fellow honorees, Mike Dowling and Kevin Sowers. Without their leadership at the height of the pandemic, things would have been much worse. We are honored that the Deming Cup Judging Committee selected healthcare leaders in this complicated year for all of us. MSK has long been dedicated to continuously improving the prevention, diagnosis, and treatment of cancer. We accomplish this through reiterative cycles of research, patient care, and education. When the pandemic hit New York City on March 1st, we were actively treating 150,000 cancer patients. We knew from earlier reports out of China that cancer patients would be at higher risk of catching and dying from COVID-19. At the same time, the staff were susceptible to this emerging disease. So there was fear and uncertainty, not only in the community, but across the institution. It was at times like these that organizational commitment to excellence matters. Cancer does not shelter in place. We had to see our patients safely through their treatment. We had to keep our staff safe. We had to absorb the impact of COVID and maintain our mission. Thanks to the teamwork and resilience of our staff at all levels of the organization, we were able to rapidly craft a new operational framework and adapt. Thanks to our laboratory staff, we developed and deployed the first FDA-approved test for COVID in New York. The rest of our research staff was sent to work from home, allowing us to redeploy the PPE used in our research labs to support our clinical caregivers. Early on, following MSK's long-term commitment to the scientific method, we adopted a plan to mask everyone, patients and staff, that entered our facilities. Ventilators were in short supply, so our critical care team made the commitment to use proning in the initial management of COVID pneumonia, and it worked. We purchased hundreds of pulse oximeters that were sent home with patients with early symptoms so they could be safely managed at home using telemedicine. At the peak of the pandemic, we were performing 2,000 telemedicine visits daily. And most importantly, we shared with and learned from our fellow healthcare organizations. As a community, we adopted and shared whatever worked. We were all in this together. These trying times are not over, but over the last 6 months, MSK's commitment to operational excellence in the face of adversity has allowed us to maintain our cancer care mission. Thank you for this recognition on behalf of all of Memorial Sloan Kettering.
Michael, Kevin, and Craig, congratulations on receiving the Deming Cup. There is no better time than this one to recognize our best leaders in healthcare. We are in a better place because of your leadership. Thank you.
Your commitment to public health, to operational excellence, and continuous improvement has never mattered more. So thank you for everything your organizations are doing to take care of people and fight this pandemic.
Congratulations to Kevin, Michael, and Craig. I, along with Ingenuity and Paul O'Neill, won 1 year, and we have to say it's quite an honor. Congrats.
I would like to extend my heartfelt, warmest congratulations to the three of you, Kevin, Michael, and Greg, and to tell you how much I admire your leadership.
And thank you for all you do to keep all of us healthy and safe during these uncertain times. Congratulations.
I think each one of your institutions is really fantastic and stands for quality and excellence in healthcare.
Michael, Kevin, Craig, welcome and congratulations.
And thank you very much for your leadership and commitment to keep us healthy.
I would like to celebrate the decision to assign this year the Deming Cup to you as leader of 3 outstanding healthcare institutions.
And welcome to the Deming Cup and Columbia Business School family.
On behalf of the judges and professional staff who make up the New York State Unified Court System, congratulations to each of our 2020 Deming Cup honorees.
It's quite the prestigious honor to all 3 of you. Well deserved, and congratulations.
Congratulations, Craig, Kevin, and Michael. And to those in your profession who deserve our respect, recognition, and appreciation for your operational excellence every single day, but especially throughout 2020. Thank you.